The slit lamp is one of the most powerful diagnostic tools in ophthalmology. It allows magnified three-dimensional examination of the eye from the eyelids to the fundus. In this video, we will discuss slit lamp biomicroscopy of the anterior segment, including the instrument, illumination techniques, and the systematic examination. A slit lamp is a binocular microscope combined with a high-intensity adjustable slit light source, allowing magnified and stereoscopic examination of the anterior segment of the eye. The slit lamp has an observation system, which is a binocular microscope with variable magnification, an illumination system with adjustable slit dimensions and angles, and a mechanical system for precise focusing and positioning. Low magnification is used for general inspection, while higher magnification helps in identifying finer details such as corneal endothelium, anterior chamber cells, and lens opacities. It can be zoom or step magnification depending on the model of the slit lamp. Multiple illumination techniques are used in slit lamp examination, each highlighting different structures and pathologies. These are diffuse illumination, direct focal illumination, indirect illumination, retroillumination, sclerotic scatter, and specular reflection. Diffuse illumination uses a wide beam and low magnification, mainly for a general overview of the lids, conjunctiva, and cornea. Direct focal illumination creates an optical section, allowing detailed assessment of corneal layers, depth of lesions, and lens abnormalities. In indirect illumination, the area adjacent to the illuminated slit is examined, which helps in detecting subtle corneal pathologies. Retroillumination uses light reflected from the iris or fundus, making corneal or lenticular defects stand out against the red reflex. Sclerotic scatter uses total internal reflection of light within the cornea, highlighting corneal edema and opacities. Specular reflection is used to examine the corneal endothelium and tear film by aligning the illumination and observation angles. Anterior segment examination should always follow a systematic sequence to avoid missing subtle findings. Begin with examination of the lids and lashes, noting the position, inflammation, crusting, and lash abnormalities. Next, examine the conjunctiva for congestion, follicles or papillae, and the sclera for thinning or nodules. Corneal examination includes assessment of clarity, each corneal layer, and the presence of deposits or scars. The anterior chamber is assessed for depth and inflammatory activity, including cells, flare, hypopyon, or hyphema. Examine the iris for color, pattern, nodules, and atrophy, followed by assessment of pupil size, shape, and reactions. Finally, the lens is examined for transparency, type of cataract, position, and the presence of an intraocular lens. Slit lamp biomicroscopy plays a crucial role in early diagnosis and management of anterior segment disorders like glaucoma, uveitis, and cataract. For exams, always mention a systematic approach, appropriate illumination techniques, and a clinical correlation.